There are killers who operate in the shadows, hiding behind masks of violence and chaos. And then there are those who hide in plain sight, behind a warm smile, a white coat, and a stethoscope. Harold Frederick Shipman was one of the most trusted figures a community could have, a family doctor. Yet beneath that respectable exterior lived the most prolific serial killer in modern British history. His victims were not strangers in dark alleyways. They were elderly patients who trusted him with their lives, and that trust, tragically, became the very weapon he used against them. Harold Frederick Shipman was born on the 14th of January 1946 in Nottingham, England. He grew up in a working-class family in the Bestwood estate, a council housing area on the outskirts of the city. His father, Harold Shipman Sr., worked as a lorry driver, and his mother, Vera Shipman, was the dominant force in young Harold's life. From an early age, Harold was made to feel that he was different, that he was better than those around him. His mother instilled in him a deep sense of superiority, separating him from neighborhood children and pushing him toward academic excellence. This emotional conditioning would shape his psychology in ways that would only become apparent decades later. The defining trauma of his childhood came when his mother was diagnosed with lung cancer. Harold watched her suffer through the final stages of her illness, and crucially, he witnessed the relief that morphine injections brought her in her final days. A family doctor would visit their home and administer the drug, easing her pain. Vera Shipman died in June 1963 when Harold was just 17 years old. That image, a doctor arriving at the door, needle in hand, bringing peace, never left him. Despite his grief, Shipman threw himself into his studies. He attended High Pavement Grammar School in Nottingham, where he was known as a determined, if somewhat socially awkward, student. He was passionate about athletics and was a capable long-distance runner, a discipline that reflected his ability to endure and persist. He applied to medical school and, after an initial failed attempt, was accepted into Leeds School of Medicine in 1965. It was during his time in Leeds that he met Primrose May Oxtoby. She was 17 years old and already pregnant with his child when they married in November 1966. Their relationship raised eyebrows at the time, but Shipman appeared to settle into family life. Together they would go on to have 4 children. Those who knew him during this period described him as confident, sometimes arrogant, and deeply focused on his medical career. He qualified as a doctor in 1970 and took up his first position as a general practitioner in Pontefract, West Yorkshire. Shipman joined the Abraham Ormerod medical practice in Todmorden in 1974. He was well liked by patients, known for his bedside manner and his willingness to make home visits. But behind the scenes, something deeply troubling was already taking root. In 1975, Shipman was caught forging prescriptions for pethidine, a powerful opioid painkiller, for his own personal use. He had been self-administering the drug and had developed a serious addiction. He was fined, required to attend a drug rehabilitation program, and was effectively allowed to continue practicing medicine after a period of treatment. This was a catastrophic failure of the medical regulatory system. A man who had already demonstrated a willingness to abuse controlled substances and deceive his colleagues was permitted to return to a position of absolute trust over vulnerable patients. By 1977, Shipman had joined the Donnybrook Medical Centre in Hyde, Greater Manchester. It was here that his killing, which investigators now believe had already begun, escalated dramatically. Shipman's method was chillingly simple. He would visit elderly patients, predominantly women, in their homes or at his surgery. He would administer a lethal overdose of diamorphine, which is the medical term for heroin, and then falsify their medical records to suggest they had been in poor health. He would often be present when the body was discovered, sometimes even calling the time of death himself. Families grieved, death certificates were signed, and bodies were buried or cremated. No one questioned the kind doctor who had been so attentive in their loved ones' final moments. In 1992, Shipman set up his own solo practice on Market Street in Hyde. This independence gave him even greater freedom. He was now answerable to no one in the immediate sense, and the death toll climbed. Investigators would later determine that he killed at least 215 confirmed victims, though the true number is believed to be closer to 250 or even higher. His victims ranged in age from 41 to 93, with the majority being elderly women living alone. The first serious alarm was raised not by a medical authority, but by a local funeral director and a fellow general practitioner. Dr. Linda Reynolds of the Brooks Surgery in Hyde became concerned about the unusually high death rate among Shipman's patients. In 1998, she reported her concerns to the coroner. However, the investigation that followed was inadequate and inconclusive, and Shipman continued practicing. The case that ultimately brought him down involved a patient named Kathleen Grundy, a former mayor of Hyde and a woman of considerable standing in the community. She was 81 years old when she died on the 24th of June, 1998, shortly after a visit from Shipman. What made her case different was her daughter, Angela Woodruff, who was a solicitor. When a suspicious will emerged, apparently leaving Grundy's entire estate to Shipman, Woodruff refused to accept it and contacted the police. Kathleen Grundy's body was exhumed. Forensic analysis revealed fatal levels of diamorphine in her system. Shipman was arrested in September 1998. The trial of Harold Frederick Shipman began on the 5th of October 1999 at Preston Crown Court. The prosecution presented evidence relating to 15 murders, including that of Kathleen Grundy. Shipman sat in the dock appearing composed, even contemptuous, throughout the proceedings. He maintained his innocence entirely, offering no explanation for the damning forensic and documentary evidence stacked against him. Newspaper front pages across Britain carried his photograph daily. Television news programs devoted extensive coverage to the case. The British public watched in horror as the details emerged. A trusted doctor, a pillar of the community, had been systematically murdering the patients who depended on him. On the 31st of January 2000, Harold Shipman was found guilty of 15 counts of murder and 1 count of forging a will. He was sentenced to life imprisonment with a recommendation that he never be released. The judge, Mr. Justice Forbes, told him that he had betrayed the trust of his patients and the medical profession in the most profound way imaginable. Harold Shipman was found dead in his cell at Wakefield Prison on the 13th of January 2004, the day before his 58th birthday. He had hanged himself using bed sheets tied to the bars of his cell window. He left no confession, no explanation, and no final statement to the families of his victims. The news was met with a complex mixture of reactions: relief, anger, and a profound sense of injustice from families who had hoped he would one day reveal the full truth. Following his conviction, the British government commissioned an independent inquiry led by Dame Janet Smith. The Shipman inquiry ran from 2000 to 2005 and produced 6 detailed reports. It confirmed at least 215 murders and concluded that Shipman had likely been killing since 1971. The inquiry led to sweeping reforms in how death certificates are issued, how controlled drugs are monitored, and how concerns about medical practitioners are investigated and acted upon. The legacy of Harold Shipman is one of institutional failure as much as individual evil. Every system that should have stopped him, the medical board, the prescription monitoring process, the coroner's office, failed. his case fundamentally changed the way medicine is regulated in the United Kingdom. The introduction of the medical examiner system, stricter controls on the prescribing of controlled drugs, and enhanced oversight of general practitioners all trace their origins directly to the Shipman case. For the families of his victims, no reform can undo the loss. Many have spoken publicly about their grief, their anger, and the particular cruelty of having trusted the very man who took their loved ones from them. Photographs of his victims, ordinary people, grandmothers, retired teachers, community volunteers, serve as a constant reminder that behind every statistic was a human life, a family, and a story cut short by a man who had sworn to do no harm.